Okay, let's continue for our topic, visual diagnosis, ears 3. Red helix. A red helix generally indicates heat, especially of the heart and or lungs. It may also indicate heat in the lesser yang channels or damp heat in the liver and gallbladder. A floating red color of the helix is due to kidney yin deficiency with empty heat. Okay, picture. Lung heat, letter A. Red helix, flaring of nostrils, thirst, red face, cough, light breathlessness, feeling of heat, chest ache, red tongue with yellow coating. And the pulse is overflowing rapid. Letter B, heart fire, red helix, red face, bitter taste, thirst, palpitation, agitation, insomnia, dream disturbed sleep, feeling of heat, red tongue with redder teeth, and yellow coating. And the pulse is overflowing rapid. Heat and the lesser yang channels, letter C. Red helix, bitter taste, hypochondrial discomfort, dry throat, alternation of cold and hot feeling with predominance of the latter, irritability, tongue with unilateral yellow coating, and the pulse is wiry rapid. Okay. Damp heat in the liver and gallbladder. Red and swollen helix, bitter and sticky taste, burning on urination, excessive vaginal discharge, irritability, feeling of oppression on the chest, nausea, vomiting, dark urine, tongue with red sides and sticky yellow tongue coating, and wiry, slippery, rapid pulse. This is letter D. Letter E, kidney yin deficiency with empty heat. Red and dry helix, tinnitus, malar flash, dry mouth with desire to sip water, dizziness, night sweating, backache, poor memory, dark scanty urine, 5-pound heat, feeling of heat in the evening, and the tongue is red tongue without coating, and the pulse is floating empty and rapid. Okay, red back of the ear. The usual cause of redness of the back of the ear is invasion of wind heat. It is also seen in the beginning stages of measles. Invasion of wind heat, especially in children, letter A. Red back of the ear, aversion to cold, fever, sore throat, headache, body ache, light sweating, tongue with red sides and or front, and the pulse is floating rapid. Letter B, measles. Red back of the ear, popular rash, fever, thirst, sweating, red tongue with yellow coating, and the pulse is overflowing rapid. Distended blood vessels on the ear. You can see in the picture. The two main causes of visible distended blood vessels in the ear are lung qi deficiency with retention of phlegm and blood stasis. Letter A, lung deficiency with phlegm heat. Distended, red blood vessel on the ear, cough, breathlessness, expectoration of sticky sputum, weak voice, tiredness, feeling of oppression of the chest, pale and swollen tongue with sticky coating. Pulse is slippery in general but weak on the right front position. Letter B, blood stasis, distended, purple blood vessel on the ear, dark complexion, headache, abdominal pain, chest pain, purple tongue, wiry or choppy pulse. Other symptoms and signs depend on organ involved. Letter C, dump heat in the gallbladder. Distended, red blood vessel on the earache, dizziness, tinnitus, hypochondrial pain, fullness and distension, nausea, vomiting, inability to digest fats, yellow complexion, and eyes, irritability, feeling of heaviness, unilateral or bilateral thick, sticky yellow coating, the tongue, and the pulse is slippery rapid. Letter D, heart hit. Distended red blood vessels on the ear, especially on the lobe, palpitation, feeling of heat, anxiety, insomnia, red tip of the tongue, and the pulse is always overflowing rapid. Excessive wax production. Okay, excessive wax production is usually caused by phlegm, which may affect various organs. Another common cause of excessive wax production is damp heat in the liver and gallbladder. Deficiency condition causing excessive wax production include spleen and kidney yang deficiency and kidney yin deficiency with empty heat. Letter A, phlegm. Excessive wax production, dizziness, feeling of muskiness of the head, feeling of oppression of the chest, feeling of heaviness, sputum in the throat, swollen tongue with sticky coating, slippery pulse. Other symptoms and signs depend on organ involved. Damp heat in the gallbladder, letter B. Excessive wax production, discharge of bright yellow wax, earache, headache, hypochondrial pain, fullness and distension, nausea, vomiting, inability to digest fats, yellow complexion and eyes, dizziness, tinnitus, irritability, feeling of heaviness, unilateral or bilateral thick, sticky yellow coating, and the pulse is slippery, rapid. Letter C, spleen and kidney yang deficiency. Excessive wax production, discharge of dull yellow wax, dizziness, tinnitus, tiredness, poor appetite, loose stools, backache, feeling cold, and the tongue is pale tongue, and the pulse is weak. Letter D, kidney yin deficiency with empty heat. Excessive airwax production, dizziness, tinnitus, night sweating, dry mouth with desire to drink in small sips, backache, poor memory, dark scanty urine, 5-palm heat, malar flash, feeling of heat in the evening, and the tongue is red tongue without coating, and floating empty and rapid pulse. Letter E, toxic heat with the stagnation of G and stasis of blood. Excessive wax production, earache, occasional discharge of dull wax, bleeding from the ear, discharge from the ear, red tongue with red points and sticky yellow coating. This tongue, diagnosing. Slippery, wiry, rapid pulse. Swelling and redness of the concha. Damp heat in the liver and gallbladder is the most common cause of redness and swelling of the concha. In chronic condition, kidney yin deficiency with empty heat may also cause a redness and swelling of the concha, whereas in acute condition, a toxic heat may cause it. You can see in the picture, okay? Letter A, damp heat in the gallbladder, swelling, and redness of the concha, earache, ear discharge, itchy ear, headache, hypochondrial pain, fullness and distension, nausea, vomiting, inability to digest spots, yellow complexion and eyes, dizziness, tinnitus, irritability, feeling of heaviness, unilateral or bilateral thick, sticky yellow coating in the tongue, and the pulse is slippery rapid. Letter B, kidney yin deficiency with empty heat, redness and slight swelling of the concha, earache, dizziness, tinnitus, night sweating, dry mouth with desire to drink in small sips, backache, poor memory, dark scanty urine, five palm heat, malar flash, feeling of heat in the evening, and the tongue is red tongue without coating, and floating, empty, and rapid pulse. Letter C, toxic heat, swelling and redness of the concha, earache, discharge from the ear, swollen neck glands, headache, thirst, red tongue with red points in stick, sticky yellow coating, and the pulse is overflowing, slippery rapid. Discharge from the ear. Okay, but the picture. In acute cases, discharge from the ear can be due to invasion of wind heat affecting to lesser yang channels or to damp heat in the gallbladder. The latter may also cause ear discharge in chronic conditions. Both kidney yin deficiency with empty heat and spleen chi deficiency with dampness may cause an intermittent thin discharge from the ear. Letter A, full, damp heat in the gallbladder. Sticky, thick yellow discharge from the ear, earache, tinnitus, dizziness, headache, hypochondrial pain, fullness and distension, nausea, vomiting, inability to digest fats, yellow complexion and eyes, irritability, feeling of heaviness, unilateral or bilateral thick, sticky yellow coating. And the pulse is slippery, rapid pulse. Okay, next. In acupuncture treatment, gallbladder 43, triple burner 5, REN 12, REN 9, spleen 9, triple burner 17, and gallbladder 2. Invasion of wind heat, yellow discharge from the ear, earache, aversion to cold, fever, sore throat, headache, body ache, slight sweating. In the tongue is tongue with red sides and or front, and the pulse is floating rapid. In acupuncture treatment, large intestine 4, LI4, triple burner 5, bladder 12, lung 7, triple burner 17. Kidney yin deficiency with empty heat, thin discharge from the ear that comes and goes, dizziness, tinnitus, night sweating, dry mouth with desire to drink in small sip, backache, poor memory, dark scanty urine, five palm heat, malar flash, feeling of heat in the evening, red tongue without coating, and the pulse is floating empty rapid. Toxic heat in the liver and gallbladder. Foul smelling, yellow discharge from the ear, severe earache, irritability, headache, feeling of heat, fever, bitter taste, sticky taste, red tongue with redder sides and red points with sticky yellow coating. And the pulse is overflowing, slippery, rapid. Spleen chi deficiency with dampness. Slight discharge from the ear without pain, tiredness, loose stools, feeling of heaviness, feeling of fullness, pale tongue with white sticky coating, and the pulse is soft. For treatment note, in wind heat in the lesser yang channels, uh, acupuncture points is triple burner 5, Li4, Li11. In damp heat in the gallbladder, triple burner 5, large intestine 4, Li11, and gallbladder for 3. For kidney and deficiency with empty heat, kidney 3 with spleen 3, Li4, and triple burner 5. Spleen chi deficiency with dampness. Okay. Li4, triple burner 5, RAN 12, stomach 36, and bladder 20, RAN 9, also spleen 9. Thank you for your attention. Have a good day, everyone.